The South African Heart Association's renowned annual Congress takes place this year at the Sandton Convention Centre from October 27 to 29. It will feature unique hands-on training sessions by some of the world's leading cardiologists. The Congress aims to develop future collaboration with other academic societies. For more on this conversation, let's speak to Dr. Farouk Mamdoo, cardiologist and Congress convener and Wits University lecturer. Dr. Mamdoo, appreciate your time. You certainly wear many hats. Let's talk about what inspired the SA Heart Association to organise a Cardiac Collaboration Congress with a focus, obviously, on some of those issues that we've talked about.
Good morning, and thanks for inviting me, Hugo. This is the 23rd annual SA Heart Congress, so we've had a number of congresses before. SA Heart is an organization that seeks to align many of the patients and doctors that work in the cardiovascular space, as well as trying to bring through a lot of the what we call allied workers, such as nurses, cath lab radiographers, as well as technologists that all work managing cardiovascular patients with complex disease. The focus of this year's Congress is slightly different. We aim to bring in a number of other learned societies, such as anesthesiologists, endocrinologists, critical care specialists, and so forth, to join us in our annual Congress and to share certain sessions with us.
Now, can you elaborate on the significance of hosting international cardiologists and opinion leaders at this Congress? I mean, let's talk about how their participation will benefit local cardiologists and healthcare professionals.
Yeah, we have quite a high standard of cardiovascular medicine being practiced in South Africa already. You know, we have many forerunners in the cardiovascular space, but as you know, the world is a big place, and technology is, especially in the cardiovascular system, is proceeding at leaps and bounds. So we often enlist the help of learned societies and academics all across the globe to bring the latest information and updates and innovations that are being developed all over the world. So the significance of this Congress is the biggest Congress in South Africa for cardiologists, where we align with a number of other learned societies all across the globe, bringing in key opinion leaders and experts in various fields to come to South Africa and update us on some of the innovations that are going on all across the globe.
Well, December 3, 1967 obviously rings a bell, I'm sure, in your mind, because Christian Barnard performed the first heart surgery on the planet, if my memory serves me right. Now, just how far have we come over the years as whilst we're an African country, obviously, we are very, very advanced, I'd like to think, in this area of medicine?
Yes, that's correct. We were fortunate enough to have such pioneers as Christian Barnard and a number of other people as well over the years. And I think our universities still maintain a very high standard of academic medicine. So we produce very high-quality doctors who are sought over all over the world. But what we're also able to do in our university training level already, as well as our specialization platforms or streams, we maintain international connectivity with innovators all over the world. So our South African trained doctors, especially cardiologists, often travel overseas frequently. They are able to gain hands-on training in international medical schools as well as universities and other sort of specialty training facilities all over the world. And we are facilitated by our keenness and our knowledge with the international community, who also often visit South Africa. There are some unique opportunities for studying various disease pathologies in South Africa or Africa as a whole, and they find South Africa particularly quite well connected with academics that can delve into various aspects of disease, and we often have joint research projects going on with these international academics. That maintains our high standard, as well as brings us in alignment with many of the other societies across the world, so that we maintain a very high standard of medicine.
Now, Dr. Mamdoo, the Congress is described as having a diverse agenda, including specialized fields like cardiac anesthesiology, endocrinology, which you've talked about, critical care, sports medicine, amongst others. I'm a little bit interested in sports medicine, and I'm going to shy away a little bit from the actual convention, but one of the things that we've seen in the last few months is a number of athletes that are suffering cardiac arrest on the field of play. Now, generally, you're expecting that these are the most able-bodied individuals and are extremely fit and shouldn't be suffering cardiac arrest. What goes on with some of these athletes? And when you talk about sports medicine, are these some of the things that you will be discussing?
Yes, we have a dedicated tract or session dedicated to sports cardiology. We have two world-renowned experts coming from various areas of the world to, there's a lot of research going on. As you mentioned, there are incidences of supreme athletes collapsing suddenly or suffering cardiac arrest. There are a number of potential etiologies or causes of this phenomenon. Sometimes it's related to undiagnosed underlying genetic disease. Sometimes these athletes are overtraining and they are developing maladaptive mechanisms in their hearts, which can be dangerous. So we seek to highlight some of the screening protocols that need to be sort of implemented when normal, I would say, general practitioner examines these patients. They are often referred to sports medicine physician specialists as well as cardiologists. There are genetic markers we have to perform on these patients. And unfortunately, there's also a high incidence of, I would say, doping and performance-enhancing drugs, which sometimes, when overdone or done incorrectly, can result in adverse effects. So we have a specific stream, and South Africa is no stranger to sports. We have a fantastic rugby team, and soccer and cricket is a very active sports community, and we have to employ these screening protocols as well as advices to general doctors looking after these patients, and to influence the sort of global community to be aware that not every person who's supremely fit or appears fit is free of sort of an underlying risk that may cause an adverse event during training or sports practice.
Dr. Mamdoo, I'm going to ask you one more question, so you can either watch the Box or the Proteas. You can take your pick of national teams to watch this afternoon. Now, what are some of the most anticipated breakthroughs and developments in heart failure therapy, coronary disease treatment, and the possibly diagnostic tools that will be presented at the Congress?
We have a number of advances in heart failure management and the way we manage heart failure. There have been very new, exciting drugs that have come to the market in the last few years that have really reduced the incidence or the prevalence of heart attacks or heart failure rehospitalizations. There are also a number of innovative tools that have come when we develop coronary artery disease platforms or work towards saving patients from heart attacks. A lot of innovative tools have come to the fore where we're able to manage patients with previously inaccessible or untreatable lesions. We've also developed a large structural heart platform, so we're able to fix various areas of the heart, such as heart valves, without necessarily opening up the chest or performing open heart surgery. We're able to treat these valves or disorders with minimally invasive techniques through catheters and wires and so forth. So a number of too many innovations and updates to mention in one phone call, but clearly there's a large number of updates that have occurred. And what's impressive about South Africa is we managed to keep up with most of these updates.
Dr. Farouk, Mamdoo, cardiologist, Congress convener, and Wits University lecturer, appreciate your time this afternoon.